Welcome to the video series awareness campaign from the Maryland Healthcare Coalition Against Domestic Violence, centered on the intersections of health and intimate partner violence. I'm Lauren Doherty, the Training and Outreach Specialist with the Healthcare Coalition, and your host for today's video. Today I'm with Penny Green, Violence Response Team Manager of Sinai Hospital and Steering Committee member of the Healthcare Coalition. Penny is going to be talking with us today about how to spot intimate partner violence in a medical setting. Penny, where do you see IPV showing up in a medical setting?
Hi, Lauren, and thanks for having me. Physical abuse is usually the first type of abuse that comes to mind for people. So you may see this with a patient who comes into the ER with a broken arm or someone who's been beaten badly, but also you might see some other signs, less tangible forms of abuse that show up as well. You might see IPV show up in the medical setting in the way the abusive partner controls what decisions are made for the victim or who is able to come to visit the victim. Often abusive partners will not allow the victim to be alone with outside help as a way to make sure the victim is not talking about abuse. You might see an abusive partner minimize the medical condition of the victim, use their diagnosis against them, or even threaten to out the victim's health status as a way to control them. Abusive partners may control medication, medical devices, and access to medical appointments.
And how can a health provider tell that this is going on?
Some of the signs that might indicate abuse is happening to a patient include noncompliance. Perhaps as an abusive partner will let the victim take their medication or go to their appointments. Doctor shopping, where instead of going to the same doctor, the abusive partner will make it so that the victim sees different physicians as a way to deter establishing a pattern that can point out the abuse. There may be a pattern of lateness or inconsistency in appointments. If the victim has obvious injuries of abuse, they may not be allowed to go to the appointment for fear someone will find out. Maybe the partner insists on being present in all the exams as a way to monitor the information that is being exchanged between the provider and the patient. Or maybe the partner just wants to make sure the victim doesn't talk to anyone about what's going on in the relationship. It's really important for the provider to pay attention to some of their body language or statements that may indicate the victim is afraid.
And what are some of the injury-related signs a healthcare provider might look for?
Yes. Injury-related signs include injuries with different stages of healing. For instance, bruises that indicate multiple injuries going over time, patterned injuries, for instance, bites where you notice an imprint, any defensive injuries, if someone was blocking a punch with their arms or curled up or kicked in the back, those would be the type of injuries you would see. Also, unexplained or unlikely injuries. If someone is experiencing an injury to the face or neck or head, how likely is it that they tripped and fell? Injuries to the wrists and arms and knees may be more consistent with an explanation for a fall.
So when a healthcare provider notices these signs, what should they do next?
It's really important for healthcare providers and healthcare systems to have a proactive and effective response to the disclosure of intimate partner violence. We recommend professionals do this through screening for abuse, documenting the abuse, and referring the patient to the local domestic violence program. Healthcare professionals can learn more about how to do this by requesting a training, technical assistance, and/or materials from our website.
Well, thanks again for being here today, Penny, and sharing such important information with us. For those of you who are interested in learning more about how to create a proactive and effective healthcare response to intimate partner violence, or would just like to connect with us, please visit our website at www.healthanddb.org.